All right, we'll go ahead and get started this afternoon here, at least in Eastern time. We're in the afternoon now, but to everyone, hello, I'm Dr. Jim Borchers, President and CEO of the U.S. Council for Athletes Health, and also the Chief Medical Officer for the Big Ten Conference. Thank you for joining us today for the third and final discussion in our series focused on reimagining athletic healthcare in 2022 and beyond. We all know that March can be the busiest month of the year in athletics, so we're grateful that you're taking time to join USCAH and our strategic partners from AG administrators for this important discussion on maximizing resources and finding value in both campus and local healthcare partners. I know our panelists are looking forward to providing insight on identifying and maximizing your healthcare network to establish a well-supported environment for student athletes. But before I introduce them, just a few logistics. The process for obtaining CEU for athletics trainers has changed slightly. You must complete an additional survey prior to receiving your certificate in 1 to 3 business days. That survey can be accessed from a QR code displayed on the screen towards the end of the webinar or through the post-event email that will be sent out this afternoon. In the same post-event email, all registrants will receive a link to view the archived video of this presentation, as well as current athletic training month promotions and links to any resources that are referenced in the course of today's conversation. Lastly, as always, you are welcome to use the Q&A function to direct questions to our panel, and we'll do our best to respond directly or answer them live. Please be patient as we strive to balance answering your questions and keeping the conversation moving forward. And now, I'm honored to introduce to you the members of our panel taking part in the discussion today. Angie Beisner is with us today, and Angie is a senior director at USCAH, working directly with our valued partners as a reliable resource for innovative solutions, first-class resources, and collaboration. She has spent more than 2 decades as a collegiate athletic trainer, serving as the head athletic trainer at a Division I institution prior to joining USCAH. Angie has also previously served as a lead athletic trainer for the USA Under-19 men's lacrosse team. We're very honored today to be joined by Dixon Gillis, who is the Chief Executive Officer of AG Administrators, the company founded by his father, Al Gillis, that has become a leader in the field of sports insurance plans, specializing in protecting student athletes. Dixon started at AG as a claims examiner, learning the sports insurance field from the ground up, following his time as a rower at both Penn and with US Rowing. Also joining us today is Chief Operating Officer of AG Administrators, James Shipp. James works to bridge the gap between clinical and financial risk management as it specifically pertains to health and accident insurance. Prior to entering the sports insurance arena, James served as an athletic trainer and athletics administrator at Towson University and UNC Greensboro. And as I mentioned, my name's Jim Borchers, and on behalf of USCAH and AG Administrators, I hope you enjoy today's discussion on cultivating partnerships with campus and local healthcare partners. Well, Angie, James, Dixon, today's conversation is really pertinent to what we're seeing in collegiate athletics. I think to kind of set the stage, I think we know that there is a crisis that is going on in some places when it comes to providing healthcare to student athletes, especially when we think about personnel. And just to highlight this, one of the conferences that USCAH works with through the COVID pandemic lost 40% of their athletic training staff throughout the 10 institutions they work with, and have not been able to replace one of those positions in the current academic year. Those types of issues around personnel have caused people to start to think about reimagining how they think about this sort of healthcare situation. And so, Angie, I think I'll start with you. Just in thinking about those comments and how we think about this, the ability to work with outside providers, outside healthcare providers, outside hospitals, healthcare systems is becoming something that we're being asked more about. So your thoughts on that as we think about this personnel issue that's come up, especially in collegiate athletics.
Thanks. Well, welcome everybody this afternoon to the webinar. I think that one of the important things to consider, I have said this several times, is that we need to move our model into a 2022 model versus a 1990s model when it comes to athletic healthcare. If we think about marketing and how much marketing has changed over the last 30, 40 years, if we were still doing things the way we were before, We wouldn't have websites, we wouldn't have social media, we wouldn't be creating TikTok videos. We'd be stuck in an old model that would no longer attract student athletes to our university. But for some reason, it's become acceptable from a healthcare perspective to keep medical care in that same model, when we all know that there's been great advances since college athletics in the 90s. So I think right now it's reimagining things both from the athletic trainers side, but also from the administration side of how can we do things different? Maybe we need to find a way to partner with our local hospital system or other groups in order to share personnel, share risks, share resources. Maybe the athletic medicine staff doesn't have to function in their own little silo in an athletic department, so they can create some better positions, create some better balance, and also have a cost saving impact. So I think we've all been resistant a little bit, but I think we're at the time now where it's really crucial that we make some big steps and big strides to look at things completely different than we ever have before.
Dixon, I know from your standpoint, as you think about these issues, it must be very, at times, curious to think about how institutions and organizations that you work with through AG will manage their responsibilities around health, safety, and well-being, but certainly risk management as well. And when you think about how you help your institutions meet these needs that they have, when you think about for example, the athletic training personnel issue that we're speaking about here at the moment, and so many institutions reach out, maybe you could just offer kind of an overall perspective, as I know AG has, such a wide variety of great collegiate partners, but how you think about this problem and think about it with your institutions and helping them find individual solutions to meet their needs.
Thank you, Dr. Borchers and Angie. We appreciate the chance to be on this call together. And I think even before the athletic training crisis and before the proverbial great resignation, institutions of every size and division and conference were being challenged with how can we increase the optimization of the convergence of clinical direction of care and financial consequence? And how can we leverage our true value in a very meaningful way while continuing to keep the student athletes' health and wellness at the epicenter of every conversation and priority? It's been an ongoing challenge. And as Angie pointed out, I think it is really time to renegotiate that vision with your own team, and mostly with the other stewards overseeing your program, whether it is your colleagues in athletic training, the financial gurus in athletics, or even across campus, whether it be risk management or other financial divisions on an institution's campus, so that you can collaborate to a really high degree that higher education is not very good at, to be quite honest with you. And so having that conversation with everybody involved is really the key to what is your value, and where are you right now, and what vision do you see moving forward with this incredibly changing dynamic of the medical environment around you? Take the money aside, as Angie pointed out. I mean, this is sharing resources. This is sharing employees potentially. This is sharing capability, whether it's learning, whether you have whatever the dynamic is on your campus. And truth be told, every campus is different. So you could apply a similar process to yielding great value and have very differing results based upon the structure of a medical facility that's integrated with your institution or not, or a team physician and their organization that's supporting their program or not. So there are a variety of different ways to find value. And I think it's just understanding where you are right now to figure out what that next step is to how you can continue to maximize those relationships.